What are the benefits of reference-based pricing? What makes reference-based pricing different than traditional funding arrangements is its cost transparency. Employers who choose to go with RBP typically have more control over rising healthcare costs and can deal with these increases in costs without interfering with their bottom line. However, it is important to inform your employees that not all healthcare systems accept capped insurances, like reference-based pricing. To ensure that your employees understand how balance billing works, it is also a good idea to hire an experienced vendor with strong patient advocacy. One of the biggest benefits of reference-based pricing is the ability to know how much a specific procedure or treatment will cost. Agreements with in-network healthcare providers can ensure that, as long as an employee visits a provider that is in-network, the total cost will be covered at the established price. While an employee can still choose to see a provider that is out of network, they may have to pay a portion of the bill out of pocket. Reference-based pricing allows employers to save money on healthcare expenditures and fixed stop-loss premiums. These savings can be passed on to the employees. Reference-based pricing has also been proven particularly useful for services like scans and lab testing. The average CT scan can range from $250 to more than $4,000, depending on the provider you go to. With RBP, you can help reduce this broad cost gap, which can be highly beneficial to both patients and healthcare insurers. This same concept applies to other types of one-time procedures, such as casting a broken arm or undergoing a knee replacement. However, reference-based pricing can be less useful for chronic illnesses, which require frequent medical appointments or routine treatments. A benefits consultant discussing reference-based pricing plans with a brand new employee. Reference-based pricing not only benefits employees but also employers. With RBP, an employer does not have to risk paying exorbitant costs for medical services that could be completed more inexpensively. Setting a cap on certain types of procedures allows employers to encourage employees to take charge of their own healthcare. Employees are then forced to consider both cost and quality when choosing where to have their procedure done, which often requires research and individual participation in one's own healthcare. The healthcare industry is one where most people do not know the cost of a particular service until the bill arrives weeks later. RBP creates higher employee engagement in healthcare decisions.